Number 16, uterine fibroids. Now, these are growths to the wall of the uterus. So these are growths that occur to that wall. And during your most reproductive years, they usually aren't cancerous. Fibroids can range in small, from tiny seeds to large bumps or large lumps that make the belly grow. And often fibroids don't cause any symptoms. Larger fibroids, though, they can cause pressure or pain to the pelvis. So now you're getting pelvic pain again. Other symptoms with the fibroids that you can get, especially the large ones: heavy bleeding during your periods, periods that last more than a week, a feeling of fullness or swelling in your lower belly, backache, frequent need to urinate, pain during sex, trouble emptying your bladder out fully, or constipation. These can be all signs of uterine fibroids. So if you're getting that pelvic pain, you're getting heavy bleeding every period, periods that are lasting more than 1 week, you're getting backache, that could be uterine fibroids. Okay, that's something you want to have evaluated. Number 17, endometriosis. Now, this is another one that I hear quite a lot. I hear it from in the PT clinic when we go through medical history. It's one that women usually will say, yeah, I have endometriosis. And that's essentially tissue that normally lines the uterus, and it grows in other parts of the pelvis. So each month, the tissue thickens and attempts to shed just like it would in the uterus. But tissue outside of that uterus has nowhere to go. And then that can cause pain and symptoms. So endometriosis can affects typically up to 11% of women between ages 15 and 44. And it's more common in your 30s and your 40s. So endometriosis pain can occur before and during your period, but the pain can be severe. So when I hear women talk about endometriosis, it's usually not a joke. They loathe it. It's not comfortable. It causes heavy menstrual bleeding, a lot of fatigue, diarrhea, constipation, nausea. It's not enjoyable.